Knock, knock, knock. All right, we're doing hand hygiene. Oh, that was a lot. Okay, my name is Brandy, and I am here to do a head-to-toe assessment on you. This is just going to be a basic listening to your heart sounds, your lung sounds, making sure that everything is functioning properly as it should be. It'll take me about 10 to 20 minutes. Is that going to be okay with you today? Mm-hmm. Okay, perfect. And, okay, could you tell me your name and date of birth?
Bridget D'Souza, 7794.
Okay, thank you. And are you in any pain right now, Miss D'Souza? Okay, perfect. And do you have any allergies?
No.
Oh, I can call you Bridget?
Yep.
Perfect. Thank you so much, Bridgie. Okay, so now I'm going to go ahead and just do an inspection on our patient. They are in the upright position. They are in a relaxed mood. Facial expression is relaxed. There is no signs of physical deformities, no signs of any type of devices used, like hearing aids or glasses. We are well-nourished, well-dressed, appropriate. We are appropriate height and weight for our age. We are in our ethnicity as well. Our skin tone is evenly distributed, and we are dressed appropriate for the weather. I don't know if I said that. And we are sitting in the upright erect position. Okay, so we are going to go ahead, and I did not see any sign of speech impairment or having difficulties understanding language. So could you tell me where you're at right now?
At your house.
Okay, could you tell me why you're here? Okay, could you tell me what time it is? Okay, could you tell me what day it is?
It's Wednesday.
Okay, thank you. LOC times 4, she's alert and oriented. So now we are going to go ahead and just assess the skin real quick. Our skin is warm to the touch bilaterally. Our hair is evenly distributed bilaterally. There is no lesions, scarring, incision sites, or rashes. Our skin turgor is elastic, and she's well hydrated. Our finger in our capillary refill is less than 3 seconds. Our fingers are nice round, no signs of clubbing, and and no piercings or anything on our hands. You never know. Let me go ahead and do this radial pulse while I'm here. Our radial pulse is 2 pus bilaterally. Okay, now I'm going to go ahead and I'm going to check our hair really quickly. So we are going to put our gloves on for our hair assessment. Put this down. All right. So now I'm going to put these gloves. All right, ma'am. So let's see. Our hair is evenly distributed. Just looking, there's no signs of alopecia. Does this hurt at all?
No.
Okay. So upon palpation, there is no sensitivity. Our hair does not have any infestations and our lesions. Okay. And we have a normocephalic head. So moving on, we're going to go to our ears. Let me get my pen light for this. Okay, so for our ears, does this hurt at all? I'm going to do it bilaterally.
No.
Okay, the tragus upon palpation bilaterally is not sensitive. And does this hurt at all? Okay, behind the ear, there's no sensitivity as well. We're going to look inside of the right ear and the external auditory meatus. There is no drainage, redness, swelling, or lesions. Along with our tragus here, there's no swelling or redness. Then behind the ear, there is no skin breakdown. And then on our left ear, there is no signs of any drainage, swelling, redness on our external auditory meatus. And our tragus is neutral color. There's no redness or swelling on that. And behind the ear, there is no skin breakdown. Okay, so now I'm going to go ahead and I'm going to have you cover one ear. Okay, I'm going to whisper 3 words to you, and I would like you to repeat them back to me, okay? Mm-hmm. Light, tight, and dynamite. Okay, then cover your other ear. Okay, cat, water bottle, backpack. Okay, perfect. So we have cranial nerve 8 intact for our ears. So now I'm going to go ahead and just take a quick assessment of our face. Our head is midline and proportional to the body. Our eyes and eyebrows and eyelashes and eyelids do not have any infestations in them. Our lips are nice and moist. Our nose is symmetrical to our ears and our eyes. And yeah, so now I'm going to go ahead and just look at our eyes really quickly. Okay, we're going to shine a light. If you would just look straight ahead. Make it on this side. Okay, perfect. So I'm going to have you look at the tip of the light. All right, perfect. And then just follow this with your eyes only. Don't move your head. Okay, and then I'm going to have you cover one eye. Okay, and then tell me when you could see my hand.
See it?
Okay.
See it? See it?
Okay, and then cover your other eye.
See it? See it?
Okay, perfect. So we have our cranial nerves 2, 3, 4, and 6 intact for our eyeballs here. Now we're going to check our nose. Okay, so our nose is midline, like I said, and doesn't look like our septum is deviated. We're going to just take a quick look inside. There are no signs of obstructions or any type of foreign objects, no polyps. Our septum is not deviated, and we do have that left NARS piercing. Can I go ahead and have you hold one nostril? Breathe in, out, okay, other nostril. Okay, bilateral patency. We do have bilateral patency, and that is going to mean that cranial nerve 1 is intact for that. Okay, now we're going to go ahead and assess our mouth here. Okay, thank you. Our lips are nice and moist. Can you smile for me? Okay, our teeth are well adhered and intact to our mouth. Can I have you open up? Our tongue is geographical rough, and our mouth is nice and moist, and no signs of lesions inside of our mouth here. Can you open up and go, ah? Okay, our uvula rises midline upon phonation, and our tonsils are a 2+. Say light, tight, and dynamite for me one more time.
Light, tight, and dynamite.
Stick your tongue out and go side to side, up and down with your tongue. Can you smile? Can you clench your teeth? Perfect. Can you frown? Raise your eyebrows for me. Down. Perfect. Now we're going to just touch your face here with, I'm going to touch your face with this cotton ball. I need you to close your eyes and just tell me where I touch your face, okay?
My chin.
Okay.
Nose.
Okay.
Forehead.
Okay. Cheek. Okay, perfect. So, with that being said, we have cranial nerves 9, 10, 12, 5, and 7 intact. Could you puff your cheeks too? Did I do that? Okay, perfect. Okay, so we got all those cranial nerves intact. All right, so now I'm going to go ahead and inspect our neck here. Could you just swallow for me? Do not be ticklish. Okay, perfect. And our trachea is midline. No signs of obstruction when swallowing. Okay, and then can I go ahead and I'm going to check your carotid pulse. Sorry. Okay. Wow, carotid pulse is nice and strong, 2+ bilaterally. All right, so now we're going to do our lymph nodes, preauricular, postauricular, occipital, submandibular, submental. Then we're going to have jugular digastric. Then I'm going to have you turn your neck. No signs of JVD here while we have it turned. Can I have you turn the other way? Up, down. And we have a full range of motion of the neck. So turn your neck again for me. We have superficial clavicular, posterior clavicular, subclavicular, and then we have, can I go ahead and have you raise your shoulders? It's fine. Then we have our subclavicular right here. Okay, it's cervical, and I'm sorry, those were cervical, not subclavicular. I'm sorry. Okay, so can I have you resist against my hands? Perfect. So cranial nerve 11 is intact there with our resistance. Okay, and then can I go ahead? We've done all of that assessment. Make sure that I've done full on. Okay, so I'm going to go ahead and have you stand up. All right, so, ma'am, you're going to have to, let me take these gloves off because they're getting a little, we've already assessed all of our essentials here. All right, so can I have you say 99? 99. 99. Tactile fermentus is bilateral. Then can I have you breathe in and out? Okay, chest rises bilateral. No signs of accessory muscles used. Is this hurt at all?
No.
Okay, no pain or tenderness or masses palpated in the back. And then can I go ahead, let me do a P diameter here. 1 to 2 for AP diameter. We're just going to take a quick auscultation of our lungs in the back here, posterior. Okay, when I put my stethoscope, breathe in and out. Okay. One more time at this left lower lobe. Okay. Okay. Okay, and one more time on this right lower lobe. Okay, the right side has 3 lobes, so we're just going to do laterally. Can you breathe in and out for me? Sorry if I tickle you. Okay. Perfect. And then 2 sides on the left. Breathe in and out. In and out. Okay. Perfect. So, and then I'm going to have you bend over for me. No kyphosis, lordosis, or scoliosis felt. Then we're going to stand for 20 seconds here with our eyes closed, not moving, just relax. Okay, 20 seconds, and our Romberg's test is negative. No signs of any swaying. So now I'm just going to have you walk to the end of the couch here normally, just like you're chilling and walking. Okay, perfect. Heel to toe that way. Okay, a little. Perfect. So we have a normal gait and nothing, no signs of pain or obstructions there. All right, so now I'm going to have you take your hands and go like this for me. Perfect. We've got all of that functioning normally. Now we're just going to go ahead and have you sit down. And I'm going to go ahead and auscultate our upper lung sounds and heart sounds while I'm here. Just lung sounds first. So does this hurt at all? Okay, no tenderness or masses palpated when palpating our anterior part of our chest. We're just going to listen to our lung sounds. Okay, good. So for our right side, we had our 3 lobes, and our left, we had our 2, and we listened, auscultated for all of those. Now we're going to do our heart sounds. So we have a aortic, first intercostal space. Pulmonic, second intercostal space. Okay, Erbs is the third intercostal space. Okay, tricuspid is our 4th intercostal space. Thank you, ma'am. Okay, and then mitral is our 5th intercostal space. Okay, and now I'm going to auscultate with my bell and listen in the apicable pulse for a whole minute for any bruits. Okay, no bruits noted, and our pulse was a regular rate and rhythm throughout. All right, so now I'm going to go ahead and just go to our abdomen here. We're just going to, at this point, I would actually physically look, but I'm not going to expose my patient. So we're just going to take a look. It's nice and flat. Well, nice and flat. The hair is evenly distributed. No signs of any lesions or masses protruding. No pulsations. And we're just going to go ahead and auscultate now. So we're going to start in the right lower quadrant. And we're just going to listen. Wow, it's really, really flowing. Okay, and then we're going to listen to our pulses, make sure there's no bruits. So I'm going to go to my bell. Okay, no bruits were auscultated. And all 4 quadrants were... all 4 quadrants of our abdomen was normal. So now I'm going to just palpate lightly, and if at any point this hurts, let me know, okay? Mm-hmm. I have to be very careful because my patient is very sensitive to ticklishness. Okay, she's very ticklish. Okay, so upon palpation, no sensitivity palpated. Okay, so for our legs here, obviously we would be exposing the legs, but there are some tight little leggings here, so we're not going to do that. But there is no pitting edema in our legs. Our legs have no lesions, no swelling or redness, rashes, any sorts of that. And then our pedial pulse is going to be, as I palpate it, 2+ bilaterally, nice and strong. Can you pull against my hands? Can you push against my hands? Perfect. Can you bend your legs for me like that? Perfect. Can you put them down? Okay. And then can you open your legs like you're making a snow angel? Close them. Do you know what a snow angel is? Okay, if not, that's fine. All right, and so now we're going to have you open your arms, hug yourself. Okay, and then you're going to go ahead and flex your arms. Pull against me and flex your arms. Push against me and flex your arms. Okay, so we have a full range of motions in the upper and lower extremities. Now we're going to do the pain and see how she could hear or feel pain sensory. So this is our pain, or that's our sharp. This is our dull. Okay, so close your eyes. What was that?
Sharp.
Okay,
Dull.
okay,
Sharp.
okay.
Dull.
Okay, so our patient does have full, she can sense the pain, so that is good. We've had a full range of motion. All right, ma'am, so I think that concludes everything today. Is there anything else you need from me? Okay, well, thank you for your time and your patience. Here's your call line, and I'm going to go ahead. Are you in any pain again?
No.
Okay, thank you for your time. You have a nice day, ma'am.